We've been talking about this issue of mental health in the past 3 weeks, and this is our last session of the Mind Gut series. And in the first week, I just introduced the topic, and last week we spoke about the second week we spoke about the issue of loss and grief. And last week we spoke with Usne, and she was talking about her personal journey of living with a mental health disorder. And now in today's session, I'm gonna be talking to Dr. Zitha, who has just come in and is going to be helping us understand the relationship between mental and physical health. Good evening, Dr. Zitha.
Hey, how are you?
I'm good, Ncebo. How are you?
Hi, good, thanks. Nice to see you, eh?
It's nice to see you too. It's been a long time, man.
Yeah, it's been ages. It's been ages.
It's been a long time. How are the little ones
No,
doing?
they're doing good. They're doing good.
Eh,
Yeah,
I know that's good. No, mama, happy.
yeah. No, everyone is happy. And
That's good. That's good to hear, Ncebo.
yeah,
And thank you so much, man, for giving me your time. I know as a medical doctor under these circumstances, you're quite a busy person, and
mm,
we really appreciate the few minutes that you have given us to have this conversation with you. So I really appreciate it. And so, guys, this is Dr. Zitha. And I met with Dr. Zitha. When did we meet? I think around 2012. It's been a long time, man.
yeah. It's been a long time, eh?
I remember it was through the SOS Sons of Splendor.
Yeah,
Yeah, it was good. And man of God, I met with Dr. Zitha. He's a medical doctor. He did his medical degree at Wits, and I have brought him in to help us understand the issue of the relationship between mental and physical health. So in the past few weeks, as I said earlier, we've been talking about mental health and the role that it plays in our lives, particularly under these circumstances, under COVID, and everything that has happened. We started talking to Uthandokazi Maseti, who is a psychologist and a lecturer at University of Johannesburg, and she spoke about her own experience of loss. And I think that was a relevant topic because of the kind of losses that people had experienced. And we looked at how do we deal with loss and how do we support people who have experienced loss. Then last week, I had a conversation with Dr. Nkateko, who is a social worker, an occupational social worker, and is also a mental health activist. We were speaking about her own journey of living with a mental health disorder. So one of the things that came up in these conversations, Dr. Zitha, is the issue that people in South Africa, or our society in South Africa generally, we do not take mental health as important as we take our physical health, which is the reason why I thought of bringing you in as a medical doctor who works in with a lot of patients, particularly with their physical health, right? And to kind of give us an idea of what is the link between these two aspects of health, and
definitely.
also hopefully help us understand that they are actually as equally as important in our lives. Maybe just to start with, what is your view on this issue of the comment that came up on several occasions in these live videos, that people in our society in general does not really take mental health as seriously as we should, and it doesn't take mental health as important as physical health?
Well, Nick, thank you for that. The reason for that is quite simple. Is the symptoms presented by mental health problems are quite different from the ones people present with when they have other issues. First person cannot always have pain. A patient that suffers from anxiety cannot say, I have a headache or my back is painful. It's something that they experience internally. It's something that they're doing on their own. And it becomes difficult to translate or relate your problems to the other person in a way that they can understand that you actually have a problem. When you tell them, I'm not feeling well because somehow my mood does not allow me to actually go out with you guys, they feel like, maybe you need money and things. But
sure,
it's something that at the moment, within your head or within your brain, something is not going right. And no how you try to compensate for it in your body, you can't. You're struggling. The problem is, it's not something that's always visible until someone does something that attracts everyone's attention. Unfortunately, most of those people who suffer from mental health end up going the downward road of committing suicide. Because problems that you can't tell people and things that you can't prove to people that they're actually happening. It takes more of putting yourself in someone's shoes and trying to understand they are not actually doing this willingly. It's something that they're fighting inside that they can't really tell you or make you understand, but you just have to understand the demon they're fighting inside, which cannot be seen by your eyes.
I see. That's a very important point you made there, that sometimes, actually in most cases, you find that people who have not been able to speak about these issues that they're experiencing internally, they end up going the downward route of suicide. So the one question I want to ask, because what came up as one of the reasons for this in these conversations that I've had before, is the issue that it is not, mental health is not integrated into our primary health system. And I wanted to hear your comment on that, or your view on that, as someone who works in the primary health care system.
Okay. In terms of our care, mental health problems are usually stigmatized. Unfortunately, it's either stigmatized or institutionalized. The stigma behind is that if you suffer from a certain mental problem, you're either classified as being crazy, cuckoo, or whatever they can put a term to it. If it's something that they feel like they can live with, okay, this person is bipolar, has personality disorders, they have anxiety disorders. Okay, what you need to go see a doctor, and if need be, then you can be institutionalized. Usually that happens because if we have a family and there's someone who suffers from a mental health problem, they will rather bring you the person for you to put in the institution, which we call institutionalization. Put them in your own hospital, see them until they feel like, no, you can now release them back to them. Even the families themselves, when they bring you that person, there's a little bit of stigma they bring you with. Like, this seems like a problem. He's a problem to us. Can you take him us, treat him, and when he's fully rehabilitated, bring him back to us, and we'll see what we can do with him. And then we as mental health, as healthcare practitioners, we are somewhere in the midline there, trying to say, this is something we can treat. You don't have to be scared of it. And when we bring him back to you, this is how we expect you to help him not to relapse back, to come back to the same institution that we're taking him out of. And we try as much as we can to bridge that gap of destroying the stigma and also decreasing the number of people that we institutionalize. Because most people, if they have the proper support structures at home, they can actually cope well with their own mental health problems.
That's interesting, Dr. Zitha. The two things that I want to go back to, which you said. The first one is the families themselves. The first thing that comes to our mind is that when someone is experiencing mental health illness, they have to be institutionalized. We send them to the hospital. And the second thing is what you said, that most of these people, they would be able to cope very well with their mental health illnesses if they had proper support. So what I want to go back to is, first, does our health system, public health system, accommodate and services mental health patients well, especially at the primary health care, for example, in our clinics and our hospitals? How are the facilities and how are the services? Do we even have proper services in those places?
The answer is yes, we do. and there are structures that are put in place to assist anyone who has a mental health problem. And like I said, when it comes to the health structure, stigma has already been dealt with, because when we see someone who's suffering from a mental health problem, we don't classify them as a problem, but we classify them as a person in need, with a problem, in need of help. And we try our best to take that person with a problem, a mental health problem, and help them with the problem. So we can help them again, send them back to society, or help them actually be integrated to a life where they can live normally with everyone and not have any other issues. And the problem with that comes with, like I said, in most cases, you have people with mental health problems. The issues will come from the family. Those are the ones that will give you problems. When the person comes, they dump the person on you. That's the thing. Like, this is not your problem. Take care of it. This person, we can't handle them at home. They are now your issue. Deal with them. And we try our best to rehabilitate the person. But unfortunately, we still send them back to the same environment that has a stigma against them, or the same environment that has, okay, this person might at any time go back to what they were. So we must always be ready. There are so many cases where a patient would deny doing something out of the fact that maybe I'm relapsing. And they will tell you, I was retaliating to how I was being treated by my family, because already they think when I do something, I'm doing it because my mind is not all right.
Oh, yeah.
Yes.
So even when they have been rehabilitated and they're brought back home, the stigma continues.
The stigma still continues.
That's a difficult one. Maybe we also need, as a society, to start having these conversations so that we understand how we can continue to support people even after they've been rehabilitated in the healthcare system. So now I want us to move on to the main question that I wanted to focus on this video. It's the question of the relationship between physical health and mental health. What is the relationship between the two?
The obvious relationship between the two is that you are, if you look at yourself, you are an existing being who has a conscious. You are an intellectual being. You have a thought process that's going on behind you, and all of that is happening in your brain. And your brain created the reality that you are viewing now. Everything that you see, how you relate to the world, how you perceive everything, your brain created that little environment, or that little space where you get to experience the world and appreciate everything around you. And that's what we call your mind. Your mind, which resides in your brain, which is a biological organ. And besides the brain regulating your mind, it regulates other things without you noticing. I'm talking to you now, but I'm breathing at the same time. I am talking to you now, my eyes are blinking, and I'm not even thinking about blinking. My hands are moving. And all of that is done because of the brain multitasking, keeping me an awake and alert being, at the same time keeping me alive. And if we look at that, if the mind, which I say is created by the chemicals the brain puts together for you to experience the world, perceive the world, have an imagination, and all the things that are happening, your thought processes. And then if something goes wrong in any of that processes, it affects not only your brain, since it controls everything that has to do with your mind, everything now starts becoming affected. And that's why when you have any problem or stress, all of a sudden you start feeling changes in your body. It's because your body is communicating to your brain that, hey, you're overworking, and the release of the hormones that you're having is actually putting me under a lot of pressure. So it's a clear and direct link between what happens in the brain and what happens in the body. Since your brain controls everything about your body, if there's something that affects you mentally, it will eventually affect you physically.
That I cannot think of a better way of explaining it. I think you've done a very good job. Even when I was thinking about this and reading about it, I never thought of it that way. The fact that the brain controls the whole human system, you know, it's And when there's something that is wrong in the brain, it affects the rest of the system. So I think what that also teaches us is that we need to look at ourselves as whole beings.
Definitely.
The different aspects of our beings that you touched on earlier, the intellectual, the emotional, the psychological, the social, the physical, all of them work together, and the brain is like at the center of all those processes. That's a very interesting way of putting it. And you spoke also about how sometimes people find physical changes in their body when they are when they are stressed. And I was thinking about this as I was preparing for this conversation. And I want you to speak to some of these physical changes that are related with the most common mental health problems. I know with myself, there was a time in the past 3 years, I had a lot of stress because of school and some personal issues that were happening in my life. And the one thing that kept on happening was stomach ulcers. And I would always go to the GP, and they would give me something, and then 2-3 days I'm back in the same system, in the same situation, until later I realized that actually when these things happen, it's always when I'm under so much pressure because of work, because of school, and all these personal things that were happening. I know it was stomach ulcers, and also my eyes. They would be very red and itchy in those stressful times. And it took me a long time to understand that actually I'm treating just symptoms and not the root cause of the actual problem. So take us through some of these physical symptoms of mental health problems, especially that relates to stress, depression, and maybe even burnout, because you spoke about people overworking. What are some of these physical symptoms that people might see in their bodies that are associated with mental health?
So no, thank you so much, because you really highlighted some of the common ones that people actually complain with, especially when they're undergoing stressful events or activities, and usually come in complaining like, oh, my stomach has been giving me issues. I've been having a lot of heartburn, and it's been like that. When your body is experiencing a stressful event, or you're undergoing any situation that puts you under a lot of strains mentally or physically, you start releasing a lot of cortisol. Cortisol is your stress hormone. It tries somehow to keep you alive and persevere through that situation. And too much of a good thing is a bad thing. We know that. And your body can only compensate for so much. And because of that hyper boost or that over, so many things that happen. Firstly, we look at your heart and all your vessels. Your BP start going up because your heart is pumping out a lot of blood to keep you active and to match up your stress levels. And then usually a lot of people complain, I'm having headaches. I'm having pain in my neck. I'm feeling palpitations. It's normal. It's how your body is trying to compensate for the raised homeostatic or the raised metabolic rate that you're now actually forced to live in. And with that, like I say, people complain of palpitations, who complain of headaches, which are stress headaches. Usually they'll also complain about pain in the back, and that leads to something we call a tension headache. And like you said, your eyes are always red. That can be due to your vision being strained because you're not accommodating well, and because you're always in a flight or fight mode at that point. Your body is in a mode where I'm trying to survive this, and I'm going to do everything to survive this. So at that rate, everything is pushed up. Your heart rate is beating fast. Your thought processes, you're thinking very fast about everything and anything at that moment. You're trying to keep, and it causes blood to be diverted from other things. Your kidneys, your organs that are not important at that time are not being given blood. Your brain must be kept up at that moment. So because of that, you end up having issues in the other organs that are being affected. Talk about something like at that moment, your stomach is producing even a lot of acid. And with so much acid in the stomach and little content to neutralize it, you end up having issues. And issues that come about is because the acid is burning against the wall of the stomach, you end up having wounds there. And that's why you end up having something we call Cushing's or curling ulcers, because of the stressful event that you're going through at that moment.
What do we call it?
Cushing's ulcers. We call them Cushing ulcers. And usually a lot of people that have them is usually those maybe they've been hit in the head with something, and then with the raise in the pressures in the head, then with the increased acids in the stomach, then there's an injury of the lining of the stomach, and then that causes those small ulcers. For you, maybe what you could have had was just maybe reflux at that point, and it results, or actually was because of what I said, the increased pressure or the increased acid in the stomach. And with that acid, you end up having a little bit more than enough, and then it goes up and down in the stomach and causes a very huge discomfort there. And another,
sure.
With stress comes a whole lot of dehydration. When you're stressed, some people don't even drink, don't even eat.
True.
They're undernourished, and it really puts a whole lot of strain on the kidneys. And your kidneys at that point are suffering because there's little blood that's coming to them because of, like I said, blood is diverted to the organs that your body is deeming necessary at that stressful moment. And that is happening. Then you might have an acute kidney injury because of you not being able to cope with stress at the moment. And a lot of people, what happens is when your body gets to a point where there is not enough blood circulating, what it tries to do is to try to make sure there's still blood that gets to the brain. Your body switches off the switch and then you collapse. Upon collapsing, your body is trying to make sure the blood travels at the same plane as where your head is. Because when you're standing up like this, your blood is going against gravity, and when you collapse, your blood is going that way, so gravity is working not against it at the moment. And which is you've seen people have see something they can't handle, and all of a sudden they black out and faint, and then you what happened? It's because your brain at that moment was not getting enough oxygen, and then your body decides to switch off the switch, and then you collapse. Then when you're level on, then blood is able to travel to the brain nicely.
So you've spoken a lot about stress. There is a question I want to ask. It's what I've also seen, especially with students and maybe like people who work in very stressful professions. Very stressful professions, and you find that they would help themselves cope with things like coffee, things like energy drinks, which are also acidic. And when you're talking about what acid does in your stomach during those stressful times, I'm just thinking about those kinds of things. What are the impact of that?
A lot of people who indulge too much on caffeine will tell you how caffeine has an effect on the heart. The enzymes that are on the heart don't really deal well with caffeine, and they'll usually complain of palpitations. I stopped drinking coffee in my first year of working because I overindulged when I was a student. I was wondering why I'm always having palpitations, and then I actually pinpointed, no, it's actually my bad habit of drinking coffee. There must be a balance between allowing your body to recover and helping your body to recover. If you're at a moment where you need to push your body to the limit, let's say you have an exam or you have a deadline that's pushing, it's always tempting to always supplement your energy levels with something. And quite detrimental because, like I said, there are certain things you're taking in to override your body's natural mechanisms of resting and recovering. And when that is happening, you are actually doing more damage than good. But it depends how long you do it. So when you have a deadline, it's not like you knew about it today. So that's why you must allow yourself the time to recover and push towards it. So there must be rest in between. You can't be working off streamline because that's how people end up having burnout. It's at a point where the body is able to cope with anything you're giving it. No matter how much you're trying to pump energy drinks or coffee into your body, it's no longer responding because everything, resource or reserve you had at that moment has been completely utilized. So those things must be used sparingly, only in moments where you feel like this is only going to be for a short time, not for something that has to be prolonged or last over a very long time.
And what about thresholds? I don't know if thresholds is the right medical term for it, because I know, for example, with substance abuse, I've worked with substance abuse patients. You find that over time they start needing to take more and more and more to get the high. And I'm thinking a similar thing might happen if you have started using things like energy drinks and coffee as your pickups to be able to function, to be able to have energy. What damage does that do?
So, like you said, you develop a dependency because it gives you a high at that moment. You knew it. I'm actually becoming low. I need something to pick me up right now. And then you take that little bit of caffeine, it picks you up, you feel all the energy and the rush, you do what you want to do. Over time, your system gets used to it. And then once your system gets used to it, just know you have come to the point where you're causing more damage than harm. And that's why it's something that should be done in moderation. Because coffee, yes, there's an article I once read saying coffee, the most legal drug everyone is taking. Because the caffeine inside, we've made it normal to drink caffeine.
Yeah.
It's when you're working in a stressful environment, company, or you're still a student, it's something that you take to pick you up. And there are other drugs people take to give them that high. And usually for them, we can see the detrimental effects right away. But with coffee, it's a drug we've integrated into society. The same way people back then integrated tobacco into society, coffee, we have accepted it. It's a drug that we all take, not because it tastes good, it tastes horrible, but to make it get and go, and we get it. So over time, there is that little bit of dependency that actually happens. Have you ever had an espresso? Is it's very concentrated coffee. There are some that can have 2 or 3 of those things.
I know people like that. I've traveled with people like that. For me, I've never been able to bear the taste of that. You know, it just doesn't taste right.
Yeah.
Okay, I want us to move on, or actually not even moving on, move back to the issue of symptoms. Because these physical symptoms, sometimes when people experience these physical symptoms, they would go to a GP and get some medication or get some over-the-counter medication, which does not necessarily solve the problem, because this is a symptom of a deeper mental health problem, not really just a physical problem. So they would maybe take medication, take pain medication or something like that. What are some of the complications that come with those kinds of behaviors?
Okay, so what we call that, there's a medical, we call it somatization. Soma just means you have somatization.
I'm losing you, Doc.
Okay, can you hear me
your
now?
Connection. We call it
somatization. Can you hear me now?
Yeah, I can hear you now.
Yeah, it's somatization. SOMIMA, sorry, TIzation. Okay. Somatization. Yeah. So it's when you experience physical symptoms that are actually, the root cause is usually more mental. Like I said, in an event where you're going through a stressful event, you come in complaining of fatigue, loss of sleep, loss of appetite, headaches, stomach pains, sometimes diarrhea, vomiting, all of those things. And then you just get there, all we do is give you over-the-counter medication if you go to a pharmacy, or they give you something, a script, to actually have something that you take to help you at that moment. In most cases, what happens is the destructive behavior that comes with that is when people feel that thing coming on. Oh, I feel the little tiredness. I feel the little stomach pain. I'm used to it. It's coming because I have a deadline. They rush to a pharmacy, get something, and treat it, and they feel a bit better. The thing is, every medication comes with own side effects. For instance, people that are abusing a lot of Brufen, they get a little bit of a headache, they rush to Brufen. Get a little bit of knee pain, they rush to Brufen. They get a little bit of pain somewhere, they rush to Brufen. And then at the end of the day, they end up having ulcers. because brufen is stomach lining. And with an abuse of that comes such consequences that you end up damaging a lot of the gastric lining that you actually intended on doing. And even other medications that they're taking. There are people who like benzodiazepines. Like, yeah, can you give me something? I'm not able to sleep. Can you give me something? I'm not able to concentrate, even if it's in the smallest doses. They will come and pay you for those things. You will be telling them, no, let's find a way to deal with these issues so that we can give you a prescription that is actually more goal-directed than just trying to treat the branches of what actually has more deeper roots. And at that point, when you give someone something and they take and they feel good, they have a tendency of coming back for that thing that made them feel good. And you say, no, you're not going to write this, they'll move from you to go to another person who might give it to them. And at that point, because when they come with a new story, because you already know the face. When they go to the other person, they tell them as if it's a new story, so that the other person can sympathize and be like, nah, you need this, and they give it to them. And no matter try to counsel them, some people are that stubborn that they feel like their way is the right way. And while you tell them, no, actually, this is actually detrimental to your health. You should not be doing this because you're pumping yourselves with drugs that are unnecessary. And at that point, people hardly listen to you because I'm the one that's not sleeping. I'm the one that is having difficulty concentrating. Like, you can't give me what I came for so that I go out and pay you the money.
Sure. And I think what I've also seen is that there are also people who have become addicted to these pain medications.
Yeah.
And they've become dependent to the point that, as you're saying, they will do anything to go back and get what gave them that feel-good feeling in the beginning. So that is also becoming a big problem. It's a second problem, a second mental health problem that they're introducing in their lives just because of not addressing the actual root of the problem. So I think the last question I want to ask you before we move on to getting some questions from the comments. Guys, you can share your questions. After Doc's response to this, I'm going to go to the comments and look at your questions. My question, Doc, is what are some of the practices that we can adopt to ensure that we are not medicating these symptoms, or that we are able to deal in a healthy way with these symptoms, or even prevent these kinds of symptoms that might come with these mental health problems?
Definitely. The first thing is developing healthy coping mechanisms. If you have a problem, you can't drink it away. You can't drug it away. First, is approaching where the problem is. Try to find solutions around it. And as much as this seems, to some people, seems trivial, like you can't talk a problem away, but finding a person to talk to, sometimes it helps. Because they can give you a different perspective about what is your problem, and that allows you to see your problem differently. Secondly is always keeping your body healthy, because if your body is at a state where it's always healthy, in the event of a stressful event, you are able to cope better than someone who is equally not healthy, but equally experiencing what you're going through. You get to deal with it better if your body is kept healthy. And like I said, keeping a healthy diet, exercising regularly, because that helps you to cope better with stress. And body is able to cope. It means it gives your mind enough time to actually approach the issues that you're facing with less impact to the body. Another thing is keeping your drug intake to the minimum. Don't take drugs unless they are indicated. And there are levels, yes, where they're indicated, but not everything needs to be drugged away. Just because you're having problems sleeping doesn't mean you need to get sleeping tablets. Sometimes you just need to face your demons and you actually get yourself sleep.
Sometimes people even take Allergex.
Allergex is a commonly abused drug. Everyone will tell you, no, I'm going to take allergics and sleep away. Those who have tell you, no, I'm going to take benzos and I'll sleep it away. But that is not the right way to go about it. It's like I said, always allow your body enough time to recover and deal with whatever is happening to it naturally. Because in the event that something happens in the future, you are able to deal with it better because your body creates memory on how to deal with what it dealt with before. So if in that process of not allowing your body to actually learn how to deal with a situation, you just came and dumped medication on top of it. If that thing happens, you start panicking again because you don't know how to deal with what is happening, even though it happened before. You find people, like I said, something happens and they're in shock. Okay, they run to the GP, give me something. I'm not able to cope. You give them what they want, they got. Something will happen a month later. They'll still come to you saying, no, no, give me the same medication you gave me last time because I can't do what you give them. Something will happen 2 years later, and then you still give them the same medication. And there will come a point where the body will not be able to properly, use that medication so that you actually recover with it. Because now we need to give you higher doses. Now we need to give you stronger tablets because you are now resistant to the treatment that we're giving you because you're self-medicating for issues that you are supposed to allow your body to allow to actually recover from. And it happens a lot. It happens a lot because what happens is people think if I am feeling something, I must actually get it away from the body. But the truth is, let your body experience that thing for that 2 days or 1 day and see how your body recovers. Once your body has discovered a pattern on how to deal with that thing, when it comes again, it deals better than it came the first time. Yes, we all have insomnia or problems sleeping now and then. But if we feel like taking sleeping tablets will help us, it doesn't. Allow your body to fight it and get through one night and see what happens. Because if you always keep pumping yourself with sleeping medication, you will end up being dependent on sleeping medication.
Sure.
There are people that are on chronic sleeping tablets because they can't fall asleep without something to actually make them sleep. So definitely there is a problem with people that are, like I said, somatizing and self-treating or self-medicating. And that always gives us a backlog of these issues. Someone comes in with something that was not supposed to be treated medically, but was supposed to be treated in a way that you face the issue and deal with it.
So thank you very much, Doc. That's a powerful thing you just said there. People medicate things that are not supposed to be medicated because they're not dealing with the actual issues. One of the videos that I did was titled "Deal with It," to say we should not avoid these problems, but we should actually face them and deal with them, which I think is an important thing. Let me take some comments and see if we have some questions there for you, Doc. I see there is a comment from Lerato Dlada saying, we also find that families become dishonest about incidents so that the patient can be admitted. Then when we treat patients, they refuse to participate because we believed families over them. So this is also an interesting take. Lerato is saying here that sometimes families lie about these patients, and you find that patients become very difficult. Have you ever experienced anything like that?
I saw one Facebook post, I think a few months back, saying if someone in the family did something wrong to you, don't report them to the police. As saying, no, I'm opening a case of harassment or so and so. Just go with them to the hospital and say, this person is crazy. They've been doing 1, 2, 3 at home. Yes, definitely they will deny. And the first symptoms of someone they say of is denying. And the more you deny, the more they put you in the hospital. So yes, families do There are dubious gains. I don't know. Maybe because usually most people who are suffering from mental health problems are entitled to disability grants. So it might be a family dispute. The person saying, no, 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 you're misusing my money. The family is like, no, his things are coming back. No, no, let's take him back to the hospital so we can enjoy them.
Sure.
So we have had cases like that where people have institutionalized their relatives because somehow they were within their rights to demand what was rightfully theirs. And the family just decided, no, 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 we're not, this is not your money. Money is supposed to take care of us. In some issues, when they have a small argument with that person, they just decide, no, send him to the hospital. And that person at that time is not even acutely psychotic or in having any other issue that you deem. And then we find that they're only in the hospital for a day or two, and then you look at them like, why are you here? They'll tell you, no, my family is the one that is actually doing all of those things. So it's not rare, it always happens.
I've also experienced something similar in some of the work that I've done with mental health patients. You find that people will be like, no, my mother forced me to come here, or my parents forced me to come here. So there is another comment from Usnentlantla Mgqibisa, or Usnentlantla Ngid, who was here last week. She's saying, I love this. We don't have to always medicate. Someone will be suffering from normal grief and bereavement, and some doctors will prescribe antidepressants instead of recommending counseling healthy coping mechanisms.
Definitely.
So this is a common thing, right?
It's very common. It's if a lot of people who go to maybe a private GP and complain, oh I lost my sister last week, now I'm having these things. Next thing, boom, a script. They go get something to help them cope. And usually it's like big guns, and you wonder like, okay, so what are you doing to this person? Because this is not something that is a chronic event. This is just an acute thing that's happening. But you're treating it as if it's something that will always be there. Because once you introduce someone to mood stabilizers and those things, they get used to certain things that are not even supposed to be introduced in their systems, and which is quite wrong. And
so why are these GPs doing this?
It's bad practice. Let's as it is. It's bad practice, and it's something that we need to change. It's the same as people giving antibiotics for flu because patients are saying they want antibiotics. Antibiotics are not.
Yeah.
So it's like I said, there's so many bad practices that are going around, especially when medication is concerned. Just because someone is experiencing an acute problem that might need a medication that is used to treat chronic ones, it doesn't mean give it to them. People need to develop healthy coping mechanisms, and as doctors, we need to be activists for such activities. We need to tell people you can actually get through this, and I don't need a drug to actually make you think that you can get through this, as hard as it is, because I don't want to cripple you for the future.
Yeah, no, thank you, Doc. Let me take another comment. There is another comment from Umelusi Ele Undosi uthi uyayibeka indaba udokotela siyabonga. So I know you understand what the leader is saying. And then there is also another one, another comment from Ulirat. I think there is also a question. Yes. Basically a question here. What about prescribed drugs for clinically diagnosed mental disorders? Okay. Do doctors consider the side effects such as addiction to these drugs when prescribing them? Benzos are addictive, right? Do you try to maybe prescribe something else and use these drugs as a last resort? Which other healthcare professionals would you refer patients to regarding the management of stress?
Okay. So there are how many parts of that question? About 3.
Yeah, 3 parts.
Yeah. So looking at the first part, she's asking about the side effects of the drugs that are prescribed to people who are clinically diagnosed, DSM criteria fitting diagnosis. In those cases, fortunately, there has been good research around the medication given to people with DSM diagnosis. We give medication that has known clinical side effects. And because of those clinical known side effects, there are already means or countermeasures given to the patient that, okay, certain doses you're not supposed to pass, because you know after a certain dose you have side effects. If you give a certain drug, you also give another drug on top of it to help deal with the side effects of that one. If you're giving this drug, yes, you must come every month so that we check your blood, because we know this drug causes a little bit of problems in your blood. If we're giving this other drug, we know it might have some issues. And because we know the issues already, so we tell you beforehand as a patient with a clinically diagnosed mental health problem that you might experience this in some cases. In your case, it might not be the case. But if you have this issue, just know it's this drug that's giving you problems. And usually patients are properly educated about the side effects of each and every drug they are given. And unfortunately, when it comes to the second part of the question, so when she said benzos are highly misused, and that's true. People like Valium, they like Valium. Can you give me a Valium? I need to deal with some issues at home. It's like I said, it's bad practice to give everyone a benzo. It has to be with the involvement, like she said, of other healthcare practitioners. I'm a GP. There are certain things I can do. There's a psychologist. There are certain things she can also do. So we need to be all integrated in the treating of that patient. I'll talk to her and I say, no, go see the psychologist. And then after the visit with her, you come back with another recommendation. If she says I must give something, then I'll give, because she has had an in-depth conversation with that person. And she's seen that there's an and with that issue, it means she's recommending that we give this person something that can actually help him or her.
Yeah, I see. So it's also that what they call the biopsychosocial model of health, that it's not just one person that should be working with the patient as if this is a machine. You feel something's wrong with your body, you go to the doctor takes out that part and they fix it, and then you go back. But it has to be an involvement of a whole lot of other health professionals, you know, psychologists, as you say, psychiatrists, social workers, you know, nurses, and all of these people have to kind of contribute to the restoration of your health. I don't know if, do you guys have any other questions? If you have any other question, keep them coming. I see there is a comment from Upiwe Mbonga saying, thanks, Doc. That is very enlightening. And then there's no other comment. If there is no other comment or question, maybe a follow-up question for Doc. We are about to close. We are 10 minutes to 9, so we have just a few minutes before we finish. Thank you very much, Doc. I think you've done justice to this question. You've really enlightened us in terms of this relationship between mental health and physical health. And I think for me, what really stood out in this conversation is what you said earlier about how being physically healthy in terms of your exercise, your eating well, is part of building your resilience, so that when these stressful events happen, your body is able to bear the weight and the pressure that comes with them. I see there is another comment from Usn Ntlantla saying, I wish that all doctors could just take a holistic approach when dealing with mental illness. A psychiatrist's job isn't just to prescribe drugs, but also to do psychotherapy. I find that some of them don't even try to do this. Why is it that there is so much bad practice, as you call it?
It's because of pressures from the patients. Same thing. When you're dealing with an issue where someone has BP, high blood pressures, this is a simple example. The first thing they will want you, as doctors, that we just pump you with medication. Go drink this, it will help your BP. But in the management of BP, the first step is lifestyle modification. The person must go home, decide what is really causing my issues. And they change that, change the diet, change their salt intake, change their fat intake, and all of that. And see what happens after they've done that. If nothing happens, then we can see that then we can give you medication. And it happens as well when you have a mental health problem. The first, like I said, the first temptation is, okay, I'm going to give you this take so that this goes away for now. Not, no, I'm going to help you deal with this so that you can know how to deal with this without having to take anything to actually make it go away. And that is a problem.
So there's also a need even for patients to be informed about these things. And sometimes I think what I've also seen in some of the GPs that I've been to, they have so many patients that they just want to get rid of you so that the next person can come in and get rid of them, instead of really exploring. Because for me, as I said earlier, I had a stomach ulcer problem, and it had nothing to do with my body as such. It was because of stress that I was experiencing because of academics and work and everything else that was happening. And I went to, I think, the same GP twice. And the only thing that guy did, he touched my stomach and gave me medication and then diagnosed me with ABS. And in a space of like maybe 7 minutes, he diagnosed me with ABS. And then when I went to another GP in KZN, because this thing kept on happening, and he was like, no, this guy cannot diagnose you with ABS. You have to rule out a whole lot of things before you get to the point where you diagnose a person with ABS and you give them ABS medication.
Definitely.
So if we are not informed about these things, and we do not even ask what this medication is for, because they just give you a set of pills and you're like happy the doctor gave you something and it might help you.
Definitely. It's a very bad social construct that people feel like every time you go to the doctor, you must always come back with medication. It's an expectation that everyone has, that when I go into the consultation, I must go out with pills. Well, it's not always the case. Some issues, like I said, we just look at you and tell you, no, actually, you can actually deal with this. It's going to be a long road for us to actually get to that point, because if I do that as a GP, I'll be labeled as a bad doctor. I went to that.
Yeah.
Don't give me anything. Just tell me go and face.
and I paid. I didn't get my money's worth
just to talk to him. But like I said, it takes an approach where you feel like, okay, no, I am a doctor. I won't give you something to drink today, but I'm going to take you to my friend who's a psychologist who can help the issue better. At least if they don't go out with prescription, can they go out with?
Yeah, that's a better approach, actually. Okay, thank you very much, Doc. I think we will end our conversation here. I really appreciate your time. I see there are no other comments. Guys, please do share the video on your timeline so that other people can see it, and also keep the conversation going in the comments even after we have finished this live video.